going to tuck his pelvis underneath him, and then he's going to squat down and he's going to maintain that exact same breathing mechanics. So he's inhaling on the first 3 quarters, holding his breath on the last quarter, holding his breath on the first half of the ascent, and then exhaling on the last half of the ascent. The other thing worth noting is hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I'm joined by Michael from One Body, and today we are going to be teaching you how to squat. The squat that we're going to be demonstrating for you today, we're going to be going through different cues and different activations that you need to incorporate for the anatomical squat. Most people, when they're taught how to squat, they end up doing the powerlifting variation, which could actually exacerbate symptoms of low back pain. If you are trying to improve function, then what you would want to do is the anatomical squat and not the powerlifting squat. So if you are somebody with low back pain, you definitely would want to start changing up the way that you squat to do it more like this. But without further ado, this is how you should squat. For the squat activations, we're going to be focusing on all the different activations that occur between the lumbo-pelvi-femoral complex, since this video is specifically with regard to low back pain. Next month, when we get into shoulder pain, we're going to be focusing on the activations that occur at the thoracic spine. And the following month, when we get into the neck pain videos, we're going to be getting into the activations that occur at the cervical spine. Before today, first thing that we want to do is we want to take a look at how exactly are you supposed to breathe when performing the squat. We're going to break this down into quarters. So imagine that you have 4 seconds down and 4 seconds up. The actual breathing pattern, you want to inhale for the first 3 quarters of the descent of the actual squat. So Michael's going to squat down for the first 3 quarters, he's inhaling. When he gets to the bottom position, the last quarter, he wants to hold his breath. And then on the ascent, he's going to hold his breath for the first half of the ascent, and then the last half of the ascent, he is going to exhale. That is going to be the breathing for the entire squat exercise. So 3 quarters inhalation, you pause and hold your breath on the last quarter, hold your breath on the middle half, and then you exhale on the last half. Next, we want to take a look at what exactly is going to be going on at the pelvis. Well, at the pelvis, we want to maintain a retroversion of the pelvis. So Michael is going to tuck his pelvis underneath him, and then he's going to squat down and he's going to maintain that exact same breathing mechanics. So he's inhaling on the first 3 quarters, holding his breath on the last quarter, holding his breath on the first half of the ascent, and then exhaling on the last half of the ascent. The other thing worth noting is now that we got the pelvis right, we want to focus on the knees. The knees, we want to drive the knees as far past the toes as possible without allowing the thoracic spine to cave forward. So the thoracic spine should remain parallel or higher to the shins. So Michael's going to do a couple repetitions. He's going to inhale on the first 3 quarters of the descent, hold his breath on the last quarter, then hold his breath on the first half of the ascent, and then exhale at the last half of the ascent. Now that we have all that, we're going to add in a little bit more activation, and we're going to do that by starting with the core. With regard to the core, we want Michael to activate the abdominals right from the start. So in the first quarter, he's activating his abdominals by bracing. Imagine if somebody were to come to punch you in the stomach. If someone's going to go to punch you, you're going to tighten up your stomach really hard. So that's what Michael wants to do right from the start. So he's going to activate his core by bracing at the core. He's then going to go down. He's maintaining the core throughout the entire exercise. He never wants to lose that activation of the abdominal muscles. The breathing is the exact same. Inhaling on the first 3 quarters, he is holding his breath on the last quarter, holding his breath on the first half of the ascent, and he is exhaling on the last half of the descent, all while maintaining that retroversion of the pelvis and bracing at the core. Now that we have all that, we're going to add in another activation, and that is going to be the gluteus maximus muscle. For the gluteus maximus, this is going to come in at the last half of the descent. So for the first half, Michael's going to brace the core. Once we get past the halfway mark, he's going to activate the glutes by squeezing his glutes together, and he's going to maintain that throughout the first half of the ascent. Once the first half of the ascent is done, he's going to release the glutes for the last half of the ascent. And everything else is the same. He's driving the knees forward, maintaining retroversion of the pelvis. He is going as low as he can without collapsing forward at the thoracic spine. He wants to maintain it parallel or higher to the shins. And he is maintaining the breathing, that same breathing pattern. Next, now that we have all of those activations, we have one left in the lumbo-pelvi-femoral complex, and that is going to be the perineum. To activate the perineum, imagine that you are doing a Kegel. If you don't know what a Kegel is, imagine you're in the woods, you have to take a pee, and you are trying to stop that pee because somebody came across you and they are trying to be a pervert and you don't want them to see you. So, right now, Michael's going to do the exact same thing. He's going to brace the core right from the start. Once he gets down to the bottom half, he's going to activate the glutes and activate the perineum as though he's trying to stop a pee. He's then going to come up, he's going to release the perineum, release the glutes, and then at the very end, release the abdominals. So all of that together, retroversion of the pelvis, drive the knees forward, he braces at the core, inhale, 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 hold the breath, hold the breath, hold the breath, exhale, exhale. And then with regard to the rest of the activations, right off the bat, he's activating the abdominal muscles. Then when he gets to the bottom half of the descent, activates the glutes, activates the perineum. Then he comes up, releases the glutes, releases the perineum, releases the abdominals, and fully exhales. And those are the activations for the squat that occur at the lumbopelvifemoral complex. And there you have it. That is how you should be squatting if you are trying to improve function and decrease your low back pain. So if you are somebody who does have low back pain, you would definitely want to incorporate some of these cues. It's going to take a lot of time to be able to get all of these cues down at once. So what you could do is focus on one cue and one activation at a time. Once you've mastered that, then you could slowly build upon that by adding more progressions. But if you do have issues with your squat and you would like to improve it, come check out our seminar on September 18th, because we're going to be going over the squat and all of the exercises that we've been covering over the last month in a lot more detail, and also teaching you how to incorporate them, when to incorporate them, and when it's going to be the most appropriate for your patient or for yourself. But that's pretty much it for today's video. If you guys enjoyed the video, be sure to smash that like button so we know to continue making these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel and hit the notification bell, as we will be uploading new videos every single week. That's it for today's video. Thanks for tuning in, and we will see you again tomorrow.